Alright, today I'd like to talk to you about autism, and here's a little acronym to use for it: always unique, totally interesting, sometimes mysterious. Today in my speech I'm going to talk to you guys about the 5 types of autism, how it's diagnosed, ways that you could treat it, the prevalence of how many people are born with autism and are getting autism, some signs and symptoms, and cause and risk factors. So first I want to talk to you guys about the types. The first type is the autistic disorder. This one is the most severe. The children who have it suffer severe language delays and communication delays, intellectual disabilities, and unusual behaviors. The next one is Asperger's syndrome, and this one's a little less mild. This people only suffer social and behavioral disorders, and the next one would be the pervasive development disorder, not otherwise specified. This one is a very less severe, if any, meaning you can't really tell if a person really has it. The only way you would be able to tell is that they possess social challenges and behavior issues. And also there's Rett's disorder. And Rett's disorder is where the child is normally growing till about 26 months of age, and then after that the child slowly begins to lose purposeful use of hands, slowed brain and head growth, and problems walking, and also these children possess seizures and very low intellectual ability. And the last type of autism is the childhood disintegrative disorder, also known as the Heller syndrome, where the child develops normally till age 2, and after age 2 they lose communication and social skills very rapidly. So this one would be the second most severe, and the first one is autistic disorder. So with that said, I would like to tell you who's affected. Autism doesn't affect one ethnic group or racial group or socioeconomic group. It affects everyone from all walks of life. And next, I'd like to talk about the prevalence of autism. There's been a study from the U.S. Center of Controlled Disease and Prevention that 1 in every 68 children who are born have autism, some sort of autism, and it is 5 times more likely to occur in boys than in girls. So that's just something cool I wanted to talk to you guys about. And how it is diagnosed. It's very difficult to diagnose autism. One, because it's not done by a medical test. There's two ways to diagnose autism. One is the developmental screening, which is where the parents have a doctor and come in and they would talk to the kid, see if he's learning at the ability, like if he's learning it quick or slow. That's one way. The next way is a comprehensive diagnostic evaluation, where they do neurological testing, genetic testing. They also do hearing and vision screening, and that's that. Next are some signs and symptoms. They have communicational challenges, slurred speech, poor language and speech skills, and some behavioral problems that they have is they rock their body, they spin in circles, they like to flap their heads back and forth. And also, people with autism, they can't point out objects of interest. Like for me and you, if we saw a plane, like, oh look cool, look at that plane, it's cool. For them, they can't, like, they like it, but they can't tell you, like, look, I like that plane, how it looks. So that's one thing that they face, which can be kind of annoying for them. So those are just some of the signs and symptoms. Causes and risk factors. One is drinking while pregnant. That could cause your child to have autism. Also, autism is genetic, and autism occurs to people who already have some sort of chromosomal disorder. Now, treatment for autism, there is no treatment for autism, but there are ways where you can decrease the severity of autism. And some of the ways that you can do that is changing of your diet, also through medication, and other things like that, going to see a doctor regularly and stuff like that. But doctors recommend that if you have autism, to get it looked at and to get it checked out by the age of 3, because the earlier you start treatment methods for it, the less severe it's going to be as the child grows up. So to conclude today, I mentioned the 5 types of autism, the prevalence, some signs and symptoms, cause and risk factors, how it's diagnosed, some treatment methods, and who is affected. So with this speech today, I hope you guys all know a little bit more about autism. Thank you.